So what is a keloid or a keloid scar? Well, a keloid in short is basically an abnormal scar. It's an aberrant way of healing a scar. And in order to understand what a keloid is, you need to understand how healing typically works. Typically, if you cut yourself, your body will go through a cascade of processes to heal that wound. And we'll start by trying to stop the bleeding, plug the wound, and then over time heal the skin with collagen, and over time just remodel that. When a keloid scar develops, that process is in overdrive. And basically, the part where the collagen is recruited to the area is a hyper-exuberant reaction, and basically too much collagen is brought to the area. It's important to distinguish what a keloid is from another type of abnormal scar known as a hypertrophic scar. A keloid scar is a thick raised scar that goes beyond the origin or the boundaries of the wound, whereas a hypertrophic scar is a thick raised scar, but it does not go beyond the origin or the boundaries of the wound. And that is a subtle distinction, but it sometimes affects the way you treat a keloid versus a hypertrophic scar. So who gets keloid scarring? Well, one of the biggest risk factor of keloids is if you have a personal history of keloid scars in the past. Sometimes this can be from an ear piercing, sometimes it could be from a surgical scar that initially healed well, that over time started to develop thickness and started causing pain. Other times it could be something insignificant or a trauma that you didn't even know, or you bumped into something and without you knowing it, you developed a keloid. That is probably the single most important factor. The next most important factor is a family history of keloids, as this can be hereditary. Certain genetic predispositions can increase your risk of keloid scarring, and certain cultural groups are more apt to getting this than others. For example, African Americans, Asians, Native Americans, those subgroups tend to keloid more than other subgroups. Certain places in the body tend to keloid more than others. Sometimes it could be from a piercing in the ear, but other places like in the middle of the chest can be a high shear or high tension area. And over time, that stretch or that tension over the wound can cause a thick raised scar. That often is the reason for developing a keloid in certain areas. Other areas like the shoulder area, where there's a lot of movement and a lot of shearing, that can also increase the progression of a keloid that's already existing or worsen a scar that you already have. So now that we talked about what keloids are and who gets it, let's talk about some of the treatments. Starting from the least invasive and milder treatments to the most aggressive treatments for keloid. One of the most basic therapies for keloids is silicone therapy, and that could be either a silicone gel or a silicone strip. The adhesive strip is useful because it applies pressure to the keloid, and sometimes that can help with preventing it from getting worse and sometimes even reversing the keloids. Similarly, in the ear, there are certain products called pressure dressings where it basically is just pinching the keloid. And that works by not only putting tension on the wound or mitigating it from getting worse, but it's also occluding the blood supply so that it's preventing for more collagen to being recruited to the area from the blood supply. Another important therapy is something called massage therapy, where you're actually applying firm pressure to the keloid, and in a way, it's acting kind of the same way as a compression dressing or a clip on the ear over the keloid. That pressure will occlude the blood supply, and that will help prevent the keloid from getting worse. Now, will it reverse the keloid? Maybe not, but it will prevent it from getting worse. Moving on to some other therapies, we can talk about lasers and now injectables. The way that lasers work is basically the same way as pressure dressing. It's basically a laser that targets the blood supply to the keloid and the abnormal scarring to prevent the blood supply from reaching the keloid to prevent it from growing even more. Other things like injectables include steroid injections, also known as a Keloid injection, and also another agent called 5-fluorouracil, also known as 5-FU. Now, these agents work by decreasing inflammation, and by decreasing inflammation, the cascade of processes that promote wound healing are inhibited or blunted. And when that's done, it can prevent or halt the progression of further worsening a keloid, and oftentimes it's enough to even reverse it. So for example, if you have a thick scar, you can do a couple of injections spaced out by a month or so, and then note if it's starting to involute or regress. Now, there are different concentration of steroid injections, and that's important to note. Using a small dose of steroid is important so as not to cause a complication known as dermal atrophy, because putting too much steroids in can cause an overreaction and halts the progression of inflammation too much, basically works too well, and then you'll have kind of like an indent or a crater in that area that used to be thick and raised. So it's important to start with a low dose, test it, see if it responds. If not, gradually increase the dose. I like to do this 4 weeks apart and starting with a low dose and doing this for at least 2-3 months to see if there's any effect. Now, 5-fluorouracil does not have that reaction, so that in some ways is better in terms of the risk profile. It just depends on how bad your keloid is and what are the symptoms that you're having. Another modality that's talked about is cryotherapy. Cryotherapy is basically just freezing the keloid, and the way that this works is by creating an ice crystal in the cells of the keloid. Those cells are now disrupted and therefore can't grow and can't recruit more collagen to the area. So what are some of the symptoms patients have with keloid scarring? Well, firstly, it's unsightly, and sometimes it could be in an area that's very cosmetically sensitive. Other times it could be very painful or itchy. The itchiness can sometimes be because there's too many of the mast cells, or basically the factors that recruit collagen into the area. And so when that cell is hyperactive, not only is it bringing a lot of collagen to the area, it also has a side effect that releases certain factors that cause it to feel itchy. Sometimes it could be very big and it could be very painful, and other times it can get in the way, and like I said, it can be a little unsightly depending on where it is. It can interfere with daily activities, and depending on where it is on your body, it can affect your normal activities or work. So what happens if you have had injections and your keloids are not getting better or improving? Well, surgery can be an option, but cutting out a keloid also increases your risk of keloids in the future, because anytime you cut yourself, you're prone to keloid, whether it's from an accident, from a laceration, or a planned surgery. Surgery can have up to 50% recurrence if not done appropriately. And what do I mean by that? Well, sometimes if you're going to cut out a keloid, it's sometimes a good idea to inject steroids at the time of cutting out the keloid to blunt the hyper-exuberant inflammatory reaction so that you're not developing a keloid from the outset. Another very important step is to mitigate tension during the time of surgery. And what that means is doing the surgery with minimal tension, undermining and getting the skin as close together without having a lot of tension, because that in itself will increase the tensile stretch and tension on the wound, which is also a very important factor for developing keloids. Another important factor is to use silicone strips after surgery and follow up with your plastic surgeon within a month to see if an early keloid is recurring. In those scenarios, injecting either steroids or 5-fluorouracil can help blunt that reaction at the outset, and addressing it before it starts to get bigger is the most important thing that you can do. Now, sometimes, despite that, very aggressive keloids can still recur despite our best efforts. And what do we do for recurrent keloids, aggressive, thick keloids that just won't respond to either surgery alone or surgery with steroids? Well, for these really recalcitrant resistant cases, this is where radiation therapy comes into play. And although keloids are a benign process, meaning they're not cancer, sometimes using radiation therapy can prevent the progression of the collagen synthesis and prevent the keloid from getting worse. Traditionally, when the keloid is removed, the radiation therapy must be instituted within 24 to 48 hours to have maximal effectiveness. This sometimes can be done 2 or 3 days in a row, depending on the severity of the keloid and other factors that you have. For example, where on the body it is, and is it a high shear or high tension area like the arms or the chest? Now, obviously radiation therapy has its risks, so this option is reserved for the absolute worst recalcitrant resistant cases, and it's almost like a last resort. Now, there are certain risks with radiation therapy, so you have to talk to your doctor to see if this is right for you. So if you have a keloid, you're not sure if it's mild, moderate, or severe, or if you have a recurrent keloid that's been nagging and you don't really know what to do, I'd love to come see you. Call us at our office and we'll go from there.